6th, 9:30 Central Time. Fatigue, sick and tired of being sick and tired. Does that ever come out of your mouth? It's one of the more common things I heard when I was in practice and even as health coaching. I'm sick and tired of being sick and tired. And tired is a little bit different than what we're talking about. Everybody gets tired. You have circadian rhythm, a clock in your body, and melatonin is released through a retinal pathway through the hypothalamus and the pineal gland that helps you get tired. Usually when the sun goes down, it's a light mediated response, and the idea is for but so many people don't do that, so lack of sleep is one of the common reasons for chronic fatigue, and we're not necessarily talking about chronic fatigue syndrome per se, which is its own little distinction or big distinction associated with fibromyalgia. Used to be associated with Epstein-Barr viral infection or chronic infection with Epstein-Barr virus. That is one of the thought processes behind why people get chronic fatigue syndrome. So chronic fatigue, or we'll just talk about fatigue, really. So it's a mystery. People go to their doctors, their nurse practitioners, their physician's assistants, and spend several years trying to figure out why they're so exhausted all the it can lead to being sick and tired or being sick and tired. So fatigue is frequently a mystery for the healthcare profession. It's common. It affects people all over the world. You hear it a lot in the United States. But the root causes of chronic fatigue, and I'm not talking about the syndrome, I'm just saying chronic fatigue, have evaded modern medical practitioners for years and years and years. It is one of the more common symptoms that doctors and nurse practitioners and PAs hear. I'm fatigued, I can't do anything, I'm exhausted. And so it can result from chronic illnesses, it can result from nutritional deficiencies, which kind of makes sense, but the causes of the actual fatigue usually remain unidentified and then they go untreated. So people that get treatment for the simple things and still their hands because it's such a vague symptom. So pinpointing specific causes for each person can be time consuming, it can be challenging, it can take some interesting and strange labs, more so than just metabolic profiles and complete blood counts. And so people make multiple visits to various healthcare providers. They get lots of healthcare bills trying to track down the elusive mystery of what's causing their fatigue. And so it can be debilitating in patients, mentally and physically, but it can also have damaging effects on relationships and careers, mental health, and overall well-being, right? So common drivers, looking at fatigue from a functional medicine approach is what we're going to talk about in this class. And there's lots of drivers and there's sustaining factors that can be correlated with this symptom, this elusive fatigue syndrome. So you really need a systematic and comprehensive approach to assess patients who don't have simple reasons for fatigue, like they work too long or they don't sleep long enough. Good morning, Wendy. Okay, so common drivers, just a list of common drivers of fatigue. Anemia. So women tend to be somewhat anemic-ish because they menstruate. Men don't have blood loss every month, women do. If they're regularly menstruating and ovulating. So anemia is a simple one to look at, although there's more to just anemia than doing a blood count and measuring hemoglobin. Vitamin B deficiency, specifically 12, but the other 1, 2, 3, 5, 6, 7, there's about 6 of them, more than that actually. Poor sleeping, there's poor schedules, there's poor habits. So these are all drivers of chronic fatigue. Mental health issues that will remain undiagnosed, metabolic dysfunction, we talked a lot about insulin resistance, metabolic syndrome, type 2 diabetes. Fatigue is part of a chronic, what that chronic issue presents as. And then mitochondrial dysfunction, that's the powerhouse of your cell. And we'll talk about how to evaluate that and what you can do about that as well. Hormone dysregulation or imbalance, and then immune system exhaustion from chronic inflammation or latent infections or exposure to toxins. So basically, this is the shining protocol that I keep telling you about. Sleep, hormone balance, immunity, nutrition, management of inflammation and infection, natural approaches, and then activity, get moving, shining protocol. So first off, essential nutrition. So anemia is a lack of red blood cells, and one of the more common underlying causes of fatigue. It's usually fairly straightforward to figure out. Red blood cells deliver oxygen to your cells throughout your body with the protein hemoglobin. And proper consumption of essential nutrients containing iron. So with low levels of hemoglobin, the oxygen is unable to be delivered efficiently to your tissue, leading to a state of fatigue that can be chronic. So you can have iron testing, vitamin B12, serum folate test to see if you have nutrient deficiencies, those simple ones, that would cause anemia. But other deficiencies, such as magnesium, vitamin B complex, that's all the vitamin Bs, vitamin C, vitamin D, zinc, omega-3s, all of those can play a role in fatigue. So really, if you're going to investigate, if you don't find anemia, you have to investigate further and measure those deficiencies, measure those to see if there's a deficient problem. So well-balanced diet is important to sustain proper nutrient levels, and that is not the standard American diet. So carbohydrates that are complex versus simple, and then proteins and fats contain vitamins and minerals that your body needs for proper functioning. It's called homeostasis. It is called physiology. Hey Eileen, hi Shelly. Thanks for coming in. Okay, so little dietary tips. Avoid refined foods. You've heard this from me hundreds of times. So sugar, processed foods, refined things, bread that's been refined, like white bread, pasta that's been refined. Eliminate trans fatty acids that are found mostly in snack foods, so think microwavable popcorn, little packages of snacks, cakes, cookies, loaded with trans fatty acids. And then avoiding just processed foods in general. So all the stuff that everybody likes, fries and onion rings, donuts, and margarine for sure. Use real butter, don't use margarine, it's fake. And then avoid foods that you're intolerant to. So food interactions and intolerances can lead to inflammation in your gastrointestinal tract. It can raise free radical damage to your tissue and reduce the ability for you to absorb the proper nutrients from what you're eating. Okay, so all the symptoms from food intolerances converge to a compromised gut barrier. You're letting stuff into your bloodstream that doesn't belong there. So if you have leaky gut, or if you have separation of cells, there's tight junctions between cells. And remember, between your bloodstream and the intestinal lumen, the interior of your intestine is one cell layer. That's it. So if there's damage and inflammatory reaction to that cell layer, you're going to get stuff in your bloodstream that shouldn't ought to be there at all, Linda. So, and food intolerance is not necessarily food allergy. There's lots of things that you're intolerant to. I told you about a hair analysis a week or two ago that can be done for, I think, about $89. So if you have sleep-related issues, which is myriad, changing your sleep patterns and the environment are proven to effectively combat restless sleep and thus fatigue. Okay, Okay, so tiredness versus exhaustion. And so if you're not sleeping for long periods, my son and I talk about this all the time because he will, he's younger, he will stay up 25 to 30 hours at a time and sometimes more, which I could do when I was his age, can't do it anymore. So the importance of sleep, it's the first part of the Shining protocol. You can't understate the importance of sleep. So proper rest is when your body heals. It's vital for a strong immune system. It's vital for just healing tissues. Mitochondria heal while you're sleeping. And so when you're asleep, your T cells and then so you need 7.5 hours ideal of sleep. So 7.5 hours, they've studied it, that is the ideal amount of sleep. So 8 hours, fine. More than that, actually your health suffers. And less than 7, your health suffers. So 7.5 hours. So that increases your immunity to the common cold, just sleeping, 32%, compared to individuals who sleep less than 5 hours a night. So you can avoid 30% of colds and viral illness from colds just by sleeping 7.5 hours a night. So you get a more functional immune system, which is essential in fighting fatigue. And so that's why the Shining protocol, the very first thing, is asking about sleep. I wrote a whole article about sleep and how to get if you want it, send me a message and I'll pop it down into your messenger, or it's on my website, healthwithout.risk.com. Both of them are on there. So briefly, create a habit of going to bed at the same time every night. So you have a circadian rhythm, you have a built-in clock, and when it's time for you to go to bed, your body will let you know through your retina, hypothalamus, and pineal gland. Stay away from computer screens and cell phones, television at least 2 hours before you go to bed. Blue light is an issue. Look it up, Google it. And we are exposed to blue light all the time compared to when I was a kid growing up. Blue light is a thing. And if you're using your phone, you're getting a lot of blue light. And then you want to wake up at the same time every wake up at the same time. Once you get that habit, and remember it's 6 weeks to create a habit, sleep doesn't seem to take that long. If you go to bed at the same time, you will wake up at the same time, even without an alarm. So when I'm teaching during the school year, 5:30 is get up time, and most of the time I wake up at 5:28, 5:29, something like that. So you wake up naturally. You go to bed at the same time every night. Or if you sleep during the day, that's a hard one. So if you work nights, that's a whole other issue. If you work nights, sleeping during the day, when your retinal response to light gets kind of goofed up. And then exercise, and it doesn't have to be running the Boston Marathon or bench pressing 300 pounds. Just walking, some moderate exercise. Swimming's great, walking's great. You don't have to buy anything to walk, right? Except shoes, I guess. Although not every society wears shoes. And that'll improve your sleep quality. And then you want to spend some time outdoors every day in natural sunlight. That helps you produce, of course, vitamin D, which helps you with absorption through your intestinal lining, your hormones, etc. And then melatonin is produced it's produced in the pineal gland, but sunlight helps with production. Keep your bedroom clean, keep it uncluttered, keep it well ventilated, and keep it dark. So the darker the better. There's a reason some people put little face masks on themselves so that they have the light getting into their retina. And then you want to turn off electrical devices. Most people sleep with a cell phone next to or on their nightstand. Probably not the greatest idea. And then use organic bedding if you can, sheets, pillowcases, and mattresses. Remember, the money you spend on your sleeping material, bedding, and mattresses is 1/3 of your life, theoretically. So if you live 100 years, you should have slept 33 1/3 years. Okay? And then mental health and chronic stress. So this is a biggie. It's a comorbidity, fatigue is, of many mental health conditions. So possible depression, anxiety, and addictions, possible contributing factors to fatigue. And some people may find that holistic approaches and individualized mental health programs, they can find those extremely beneficial for combating those without having to take pharmaceuticals that have side effects that can lead to more chronic fatigue. So you got meditation, you got yoga, you got breathing. Breathing's a biggie, and then support groups, and then more serious mental health issues you may have alterations in your brain chemistry that is causing mental health issues. That takes a mental health professional to help you get through all that, especially if you have an altered brain chemistry. And then chronic stress, being hyped up all the time, it dysregulates a whole bunch of stuff, including your immune system. And your immune system is your inflammatory response system. So if you lose the regulation of your immune system, you have pro-inflammatory responses. So even if you have an exceptionally healthy lifestyle, so you exercise, you got a good diet, you're sleeping, if you're stressed out, it negates all those positive factors. And so elevated stress levels always alter your immune system's ability to function properly. And your metabolism, very common factor contributing to prolonged fatigue. So it can happen in multiple ways. Unregulated blood sugar levels, whether from insulin resistance or hypoglycemia. If you've ever been hypoglycemic, you are very, very fatigued. And that can be a primary factor in fatigue and feelings of weakness, just dysregulation of blood sugars. So if you have inconsistent and fluctuating levels of blood sugar due to insulin responses to what you're putting in your mouth, which even occurs with aromas, and sometimes even thinking about food, you can spike your insulin. But insulin disrupts your hypothalamic pituitary adrenal axis, resulting in an onset and worsened state of fatigue. So obesity is another common. All people that have type 2 diabetes or insulin resistance are heavy or obese. You can read the literature on that. I mean, there's plenty of people that are normal weighted and do everything right, technically, but they still develop insulin resistance. Usually it's a dietary problem, it's a hormone problem. Obesity is a hormone problem. And then mitochondrial dysfunction, and we'll do a whole class on that, on this one, because I found some really interesting stuff on mitochondrial dysfunction, and that's been recognized now as kind of a big issue. So you can have chronic conditions like myalgic encephalomyelitis or chronic fatigue syndrome, fibromyalgia, etc. Can result from an incompetent or inadequate cell danger response rather than just a biological stressor. So mitochondria, and it shows a cascading cellular healing response and process. That process is how cells heal themselves and restore themselves to functionality after being injured by toxins and infections or other inflammatory agents. A dietary way of doing that is autophagy, which kicks in about 24 hours after you've last eaten anything other than water or coffee. So intermittent fasting, you can read positives and negatives, but they have shown that autophagy helps improve cellular healing. So the mitochondria is the little powerhouse in your cell, vital it has a vital role in cell communication between each other's cells, and then immunity, and then the regulation of the cell's healing cycle. And mitochondria get attacked by free radicals and inflammatory changes that occur. Response. Therapy should be aimed at assisting the function of mitochondria and improving the healing cycle of the cells. So a promising candidate for mitochondrial treatment is just magnesium. It's a necessary component for mitochondrial function and production of ATP. That's where your ATP, adenosine triphosphate, is made. And then another functional nutrient is coenzyme Q10. Any of you all that are on Lipitor and all those cholesterol thingies, drugs, are losing coenzyme Q10 levels. It's right on the product label. So every one of those lipid-lowering statins lowers your coenzyme Q10, which is involved in this cellular healing process, as well as the efficacious. Okay, so those little free radicals running around zapping you, coenzyme Q10 helps scarf them up. So does vitamin C. So this recommendation is a 300 milligram dose of coenzyme Q10. Dr. Andrew Weil has always said you should take at least 100 milligrams, preferably 200 milligrams of coenzyme Q10. For those with chronic fatigue, they're saying that 300 milligrams of coenzyme Q10 helps reduce mitochondrial fragments and enhances intracellular ATP levels in people that have fibromyalgia and chronic fatigue syndrome. So, underlying causes of mitochondrial dysfunction, which we'll go through in more detail either tomorrow or Friday, I'm not sure. So, avoiding excessive free radical production, and if you have it, CoQ10 will help scavenge it, as well as vitamin C and selenium, all the antioxidants. You want to increase oxygenation. You increase your oxygenation. You want balancing of your hormones, so get rid of hormone dysregulation. Get sufficient sleep so that mitochondria can repair themselves while you're sleeping. Excellent nutrition in respect to micronutrients, addressing poor digestive function, dysbiosis, the abnormal gut microbiome that can occur from leaky gut or just gut issues, and then protection of mitochondrial function by activating antioxidant pathways, CoQ10, vitamin C, etc. Then stabilizing blood sugar levels. You don't want them bouncing all over the place. They create inflammatory response. Identifying allergies and intolerances and food sensitivities and avoiding mitochondria undergo so that they can repair themselves. Then number 6 on this is hormone dysregulation, so imbalanced hormones. So people with ongoing fatigue, both men and women, have dysregulation in their sex hormones, their thyroid hormones, their adrenal axis, and unfortunately it's tough to determine whether fatigue or hormone dysregulation preceded the other. So which came first, the chicken or the egg? Hormone dysregulation to fatigue, or fatigue leads to hormone dysregulation? Either way, you have to balance your hormones. So we do know that once they're both present, chronic fatigue and hormone imbalance, they become intertwined. And both of those issues interact with the immune system's ability to function properly, and that leads to sustained states of fatigue and exhaustion. And so continual dysregulation of the body's stress hormones is also a major contributor to chronic fatigue. So when you're dealing with chronic stress, your body becomes overwhelmed and cannot effectively maintain physiologic homeostasis, so physiologic stability. And with this defunct ability to maintain homeostasis, and so once you're wrapped up in a chronic a state of stress, your brain attempts to reduce cortisol production to protect your hippocampus, the seat of your memory, from being negatively affected by cortisol. And that results in a state of low cortisol and or epinephrine output, which then turns into burnout. So complete and total utter exhaustion, burnout. So there are adaptogenic herbs that help. Ashwagandha, holy basil, rhodiola, or ginseng can help restore hormonal axis homeostasis or bioidentical hormones and hormone optimization for each person. And then finding ways to reduce stress, so meditation, yoga, cognitive behavioral therapy, etc., to breathing, to fight the overproduction of cortisol. And then immune exhaustion. So chronic infections run around all the time, and if they get so if you're already struggling with chronic fatigue syndrome, and then you add a chronic inflammatory infection on top of that, Epstein-Barr virus, Lyme disease, Ross River hepatitis, HIV, cytomegalovirus, that chronic fatigue and dysregulation of the immune system and the exhaustion of the immune system let those pathogens persist inside your body. So you're struggling to fight off a pathogen leading to chronic infection, and although your immune system may be functioning, it's incapable of completely eradicating that pathogen. So that's the second eye in the shining. So over time, that leads the immune system to be exhausted and dysfunctional. It can no longer compete with pathogens. And then if you add some heavy metal toxins, environmental toxins, pesticides, etc., that you're exposed to all the time, you basically are continuing to suppress your immune system. And so while those toxins are present and you have a prolonged fight with pathogens, your body remains in a state of chronic inflammation, the basis of most chronic disease. And so the body's unable to completely heal itself, leading to sickness and behavioral responses, which is an evolutionary reaction where the body's energy resources are directed toward resolving a persistent inflammatory condition. And so chronic inflammation can also interfere with the hippocampus, your memory seat, the ability of that to function properly, and that further exacerbates dysregulation of the hormonal axis through the hypothalamus. So you have to figure out how to re-energize your immune system. So it's vital to determine which infections are the driving factors, and once that mystery is figured out, the proper steps to reduce that pathogenic load can be implemented. And then getting rid of toxin exposure, heavy metals, environmental toxins, etc., will help boost the immune system and help fight off that chronic pathogen. Ozone therapy is used by a doctor, functional medicine doctor in Colombia. She swears by ozone therapy, and that's been a proven method for activating the immune system. If you don't have access to an ozone therapy doctor, then L-glutathione injections will supercharge your immune system. Okay, chronic inflammation and exhaustion are not irreversible. Neither is type 2 diabetes. I was taught that that's a chronic, debilitating disease that will continue to run rampant. That is not true. You can reverse type 2 diabetes and insulin resistance, and actually most chronic diseases that have this underlying if you have chronic pathogen load, you can help get rid of that, and then homeostasis can be achieved once again. So what compromises your immune system? So deficiencies of nutrition, acute and chronic inflammation, stress and trauma, poor sleep and circadian rhythm disturbances, lack of exercise, previous or co-infections, toxins, impaired detoxification pathways, inflammatory diets, food allergies, food sensitivities, and food intolerances. So inflammatory diet, think sugar, simple sugar. Leaky gut or impaired gut health, so if your microbiome is off, hormone imbalance, mitochondrial dysfunction, metabolic syndrome, type 2 diabetes, obesity, heart disease, cancer, chemotherapy, pharmaceutical meds, think statins, and surgery. Surgery is basically controlled assault with a deadly procedure. So that's the thoughts on chronic fatigue. Hey, Rachel. And the functional medicine approach to that, it takes more than just doing a CBC and a metabolic profile, comprehensive metabolic profile. You have to look into it a little closer at times. If you have a simple problem like you're anemic and you're iron deficient, that's a pretty easy fix. Some of the other things we just talked about the last 30 minutes, a little bit more difficult to figure out. It's mysterious for many healthcare professionals. So that's a quick primer on chronic fatigue. I did find a really some interesting information on mitochondrial dysfunction. So our next class will be mitochondrial dysfunction, and we'll do a deep dive in that. Have a great day. It's nice and sunny here.